In this video, we will discuss orbital dermoid cyst. Orbital dermoid cyst is a choristoma, meaning histologically normal tissue in an abnormal location. It arises from ectoderm trapped along embryonic lines of closure. Dermoid cyst is lined by keratinized stratified squamous epithelium. They contain dermal appendages such as sweat glands, sebaceous glands, and hair follicles, whereas epidermoid cysts do not contain adnexal structures. Types: dermoids may be superficial, that is located anterior to the orbital septum, or deep, located posterior to the orbital septum. Dermoid cysts are among the most common orbital tumors seen in children. Symptoms of superficial dermoid. Superficial dermoids usually present in infancy as a painless supratemporal swelling. Occasionally, it is located in the supranasal orbit. Symptoms of deep dermoid. Deep dermoids often present later in adolescence or adulthood with slowly progressive proptosis, or may present acutely with an inflamed orbit due to rupture. Signs of superficial dermoid. Superficial dermoids are firm, round, smooth mass which are non-tender and usually 1 to 2 cm in diameter. They are mobile under the skin, often tethered to adjacent periosteum. Posterior margins are easily palpable. It indicates lack of deep extension. Signs of deep dermoid. Deep dermoids present with proptosis, dystopia, and mass lesion with indistinct posterior margins. These suggest deeper orbital involvement. Imaging of superficial dermoids typically shows a well-defined heterogeneous cystic lesion confined to the anterior orbit. Imaging of deep dermoids also show a well-circumscribed lesion. Some deep dermoids associated with bony defects may extend into the inferotemporal fossa or intracranially. Treatment. Small asymptomatic lesions may be observed, but the risk of rupture should always be kept in mind. Associated inflammation can be managed with oral steroids. Superficial dermoids are treated by complete excision in toto. Extreme care is required to avoid rupture, as spillage leads to severe granulomatous inflammation. Deep dermoids should also be excised completely whenever possible. Deep dermoids tend to enlarge and may leak into adjacent tissues, and this leakage induces inflammation and subsequently fibrosis. Incomplete excision leads to recurrence with persistent low-grade inflammation. A key surgical principle is to avoid rupture of the cyst wall, as this causes granulomatous inflammation of the surrounding orbital tissues. To summarize, orbital dermoid cyst is a choristoma from ectodermal inclusion along the embryonic suture lines. It is the most common orbital tumor in children. The most common location is supratemporal orbit. They can be superficial or deep. On CT, a well-circumscribed lesion can be seen. Treatment is by excision in toto and avoid rupture at all costs.